Yeah, so welcome everyone. Thank you so much for joining us today and for the launch of the Community Conversations with Poverty, Lessons Learned During COVID-19, co-hosted by the Division of Sustainability as part of our Health Equity webinar series and the Saskatoon Poverty Reduction Partnership. It's so great to virtually see so many of you here with us. I'm so glad you could join us today on this beautiful fall day. The Division of Sustainability as a unit in the College of Medicine at the University of Saskatchewan is located on Treaty 6 territory and the homeland of the Métis in Saskatoon. The College of Medicine works and partners with communities, clinical faculty, and its students learning on Treaty 2, Treaty 4, 5, Treaty 6, Treaty 8, and Treaty 10 territories and the homeland of the Métis. And we acknowledge the Indigenous peoples as ongoing and current stewards of this land. And wherever you may be joining us from, please do your own silent acknowledgement of the traditional people who inhabit the territory where you live. My name is Erin Wolfson, and I'm the Community Engagement Specialist with the College of Medicine at the University of Saskatchewan. And throughout the fall, we plan to join together every Friday to discuss lessons learned during COVID, how they intersect with the 12 bold ideas to eliminate poverty, which we'll talk about today, and how to move forward. These online conversations will explore topics such as housing and homelessness, serve and income assistance, racism, the criminalization of poverty, youth poverty, the digital divide, access to technology, and more. And so as we'll discuss over this series, the 12 bold ideas to eliminate poverty in Saskatoon is a blueprint for how to enact change. And there is much that we've learned since COVID. We recognize the urgency in this work and that we all have a role to play. So how do we move forward? That is what we will begin to discuss today and continue over the next few months. If you want to see past recordings or learn about future sessions, please visit our Engaging for Health Equity website, which thank you, Joanna, for adding the link to the chat. Next week, October 9th, we will be joined by the Saskatoon Housing Initiatives Partnership, or SHIP, to discuss COVID-19 in the context of World Homelessness Day, a closer look at what COVID-19 has taught us about the Homelessness Action Plan. On October 16th, you join us as we recognize the International Day for the Elimination of Poverty, which is held every year on October 17th, as we take a deeper dive into understanding the poverty line and the market basket measure. And I believe Dr. Chuck Plant, who's going to be part of that conversation, has joined us today. So stay tuned for more information about registration on our website or follow us on social media. The information about these upcoming sessions should be there later today. I'd just like to quickly acknowledge my colleague Joanna, who is here with us as well, and Tyler from the College of Medicine. Thanks so much for supporting the IT and behind the scenes support. If you have any questions about WebEx, not sure where the chat is, if you have any suggestions or ideas for future conversations, please drop us an email. I'll just put our email in the chat in a minute. And please do use the chat today if you have any questions or any comments that come up for you. We really do hope that these conversations are a place for discussion, so we'll hopefully leave sufficient time at the end for that. So without further ado, I'd like to introduce my co-host for this series, Colleen Christopherson-Cote. As many of you know, Colleen wears many hats, and today she is joining us as in her role as the coordinator for the Saskatoon Poverty Reduction Partnership. Colleen also played and continues to play an instrumental role in the Saskatoon integrated response to COVID-19, which we will discussing today. So over to Colleen.
Awesome. Thanks so much, Erin. I'm assuming that you can still hear me. Yes, everything's good. We had some tech issues with the slide deck, and so I'm grateful that Joanna will be forwarding the slides for us. And so before we get started, I also would like to do an acknowledgement. I wasn't sure how many folks from the listeners would be from Saskatoon specifically, because DSA has such a wide-reaching audience, and so I just want to situate the work. So Saskatoon is a city with rich histories. We're located on the South Saskatchewan River in Treaty 6 territory and the homeland of the Métis. It's important that we acknowledge the people from the past who play a key role in establishing what is now called Saskatoon, and that in all of this work we respect our ancestors and cherish the relationships with one another as we work to build a poverty-free Saskatoon. So we're going to spend the next little bit talking specifically about some work that was pre-COVID, and then how COVID impacted the work, and then where we're going next. And so if you can forward the slide, please. Now, here goes the tech. Joanna, can you forward the slides or no?
Joanna, if you want to do the host role, I can take over and do everything.
I always joke that we've been in COVID for like 80,000 years and we still have tech issues. All right, I'm going to minimize my screen a little bit and pull up.
Tyler, it sounds like Joanna's having
significant issues.
So if Tyler, you can take over, that would be great.
I don't know if Tyler can just take over. I think she has to give it to him. All right, so while we're figuring out that piece, I'll just give you sort of the overview. So I'm going to run through some pre-COVID pieces, specifically about the 12 bold ideas to eliminate poverty. All of the links to all of the documents that we refer to will be provided after the recording or after the event, and so you can go on to the DSA websites where all of this information is going to be housed, and you can get access to all of those links. Like Aaron said, the interagency response to COVID was one of the pieces that I have been connected to over the last handful of COVID years. And so I'm going to talk about specifically what the interagency response did. I'm not going to spend a lot of time diving deep into the actual response. There's a lot of information available online, and so the websites and the documents for those reports, et cetera, will also be available. And then I really want to spend some time talking about the lessons learned from the 12 bold ideas and what the interagency response to COVID did, particularly around a vulnerable sector strategy. And then the next steps that are coming. And so hopefully I didn't make a ton of PowerPoint slides. There'll be some opportunity for questions and reflection, et cetera. But like Aaron said, feel free to pop some comments into the chat. I have my Everyone tab open, and so I should be able to see when questions pop up. And I think Aaron will also be monitoring those pieces for us. All right, so I just want to take a step back and talk specifically about poverty. Many of the, somebody made me the host. Am I supposed to say okay? Now what happens? I don't know what happens now if I'm the host.
I don't know why it went to you. It should have went to me. If you want to just share your screen, you should be able to share your screen and advance your own slides. I'm not sure why the host went to me. Sorry.
You think? Share file. I can, there it is. Oh, now can you see that?
Still says that we're seeing Joanna's slide deck. There we go. Now I see yours. I see the very first page, though.
All right, now I'm going to go. Maybe. Oh, it won't let me advance.
Joanna, can you advance? I'm not sure what's going on. I've never had this problem before. Sorry, I wish I could help more with this problem, but I've never seen it before. So I've reached out to a couple of colleagues, and I'm waiting for them to hear back.
I'm not able to either, Tyler, so I don't know what to do right now.
That's okay. I can just
I've made Tyler, you are the host now, so.
It says I'm the host.
Okay, so
Okay, so while we're still trucking through this, I'm just going to go. So In the 12 bold ideas to eliminate poverty sort of pre-COVID, we talked very specifically about how poverty looks different for everyone and that poverty shouldn't exist, that this is a human rights-based issue and that poverty is actually the outcome of poor system policy and the lack of government's reaction and response to creating good social public policy. And that this is more than just about the unequal sharing of resources, that the elimination of poverty is a multi-sectoral and interjurisdictional response. And we need to look at the relationship between policy and practice to create the circumstances that stop plunging people into poverty and keeping them there. And so the 12 bold ideas was generated through a series of consultations over about an 18-month period and has emerged as a sort of multi-sectoral and interjurisdictional, multifaceted approach that looks at the ripple out and implications of changing one sector's policies and how it impacts others. I think it's also important, given the things that have emerged over the last couple of years, and more specifically even during COVID, is that racism and poverty are deeply intertwined, and that systems that are generated to keep people safe and to provide them services and supports are often perpetuating systemic racism. And that even though we're on a journey of truth and reconciliation, and that there's broad multi-sector support and understanding for the commitment to the truth and reconciliation calls to action, UNDRIP, MMIW, calls to justice, and all of the treaty relationships, that we're just starting a path to move forward. And that even if we look at some of the materials and suggestions that have happened over the last sort of 6 to 8 months, we know that the overrepresentation of Indigenous folks in systems and in poverty requires a for Indigenous, by Indigenous solution. And so the disruption and dismantling of colonial constructs is part of the work. So the 12 bold ideas, there's 12 of them. So income, asset building, the need for social enterprise and innovation, childcare, education, healthcare, transportation, access to good food, access to affordable and appropriate housing. There's a role for the justice sector to play, particularly in the decriminalization of poverty and the role that plays for women, particularly women of color, and the role of apprehension of children in that conversation. We also know that literacy and non-formal or informal education services are a critical piece. And then ultimately, system navigation plays a key role. And so it's interesting when you look at the 12 bold ideas pre-COVID and the way they interact with each other, and then overlay the COVID lens on top of them and look at the way that COVID and the interagency response to COVID responded. All 12 of these ideas and all 12 of these sectors were intertwined in that response. Sometimes the interagency response was directly involved, and sometimes it was a government or agency response. But every single one of the things that we implemented throughout the course of the most urgent part of the response had at least one part of those 12 bold ideas built into it. So I think when we start talking about the actual 12 ideas pre-COVID and even post and moving forward, I just want to unpack a couple of the pieces of it. So in the document for 12 bold ideas, we know that we talk about income and that people need income to support their basic needs. And so when I unpack these ideas, think about the things that you learned during COVID and the things that you saw as responses, not just even in Saskatchewan, but across Canada. We know that people's poverty and the needs that they have are different for each person and each family, and that they change sometimes inside that family over time as well. We know that there's a difference between equity and equality, and we know that people need to be able to build and accumulate assets. Assets are that safety net that allow people to be able to enter into uncertain times and have some kind of safety net that will support them moving forward. We know that people need meaningful employment and training opportunities, and we know that COVID interrupted those pieces. We know that people need access to flexible and affordable and reliable and appropriate childcare. COVID really shone a light on the role of childcare in our systems. We know that investment in the early years is required to break cycles of poverty, and that children shouldn't be living in poverty. We know that we need a school system that is youth-centered, and it needs to be responsive to community need. That was highlighted throughout the COVID response and is still playing a role in many of our lives for those of us who have children in the K-12 system. Well, looks like maybe my slides are up. I'm on slide 8 if someone knows how to advance. Education is the key to breaking poverty. And so we've seen some media over the last little bit around what learning about inequity might or might not encourage. And so I would really focus the conversation on what the role the education system plays in breaking these cycles. They're often left out of the conversation and shouldn't be. We need to encourage an education system that is designed to maximize participation and create diverse learning opportunities for youth and families with complex needs. And people need access to a really great healthcare system that focuses on what they need to be healthy and not what they need just to get out of being sick. And poverty, so it's important around the healthcare piece to mention the fact that poverty is a risk factor for poor health, and poor health is also a risk factor for poverty. And so they are interconnected and intertwined, and those pieces were very obvious during the COVID response. Transportation and public transit is a critical piece, and we saw that piece emerge as well throughout COVID. We know that people need access to healthy, affordable food in all of the neighborhoods that they live in, and I'm going to talk a little bit more about how important the food response was in COVID. We know that people need safe, affordable, and appropriate housing. And we know that housing system in Saskatoon is lacking transitional housing, but also that systems, particularly the justice system, the foster care system, the health system, and even the education system, are perpetuating poverty by releasing, discharging, whatever the term is for that sector, people into nothingness or into homelessness. And that process needs to stop. Families need to stay together, and the decriminalization of poverty needs to be in the forefront of the work moving forward. People need the skills and knowledge to improve their circumstances, to break cycles of poverty, and people need to have access to broad community supports, no matter where they turn or when they ask. And so those were the pieces that were built pre-COVID, and those are the things that we were working towards. And then in March, COVID rained its parade on us. And we were having a lot of conversations around how we would implement these and what we would be doing to move forward. And many of the community partners who are providing direct services to many of the most vulnerable folks in Saskatoon were reaching out to myself through the SPRP and the Safe Community Action Alliance, and to Bonnie Howman, who's the co-facilitator of the Safe Community Action Alliance, to see if we would be talking specifically about how we might respond to COVID. I think early in March we were a bit delusional that we didn't think it would be that big a deal, and then things started to change. You see them change?
Yes, it is.
Woohoo! Now I just need to find out which button I'm on. That's good because most of this is going to be new material. So this is where I am. How's everybody feeling now?
Sorry, I thought we tried this before everybody got here.
No, we did, but I don't know what's going on.
So we got it working now. Sorry,
I think it's all good. I'm sorry I was chatting to just a sort of empty screen, and I have no idea what my video looked like because my head was covered with my screen. So whatever. So in the early part of March, this conversation started to emerge because community agencies had to close their doors. And these conversations emerged around what maybe we could do with the intersectoral collaborative tables that existed in Saskatoon and how we might be able to work together in a different way. Early on in the conversation, the interagency response to COVID team, which was probably about 5 or 6 folks in the beginning, was trying to work under the same models that we normally work under in community practice, so constellation style of governance, consensus building, collaborative process. And we soon learned that the urgency and the pace of the COVID response would be such that those types of models wouldn't be efficient. And so we reached out to the emergency management team with the City of Saskatoon, and they introduced us to the incident command structure. And so when we were having conversations about incident command, and really quite reluctant to build a hierarchical kind of overlay on top of the work that we were so entrenched in. We started to realize that there would be no other way to do that. And during those conversations, we focused the idea that, we all need to define what we mean by vulnerability. And so in Saskatoon, for the interagency response to COVID, we used two predominant definitions for what we were going to work on as far as vulnerable populations. And so those were folks who were made vulnerable through housing insecurity. So they're either homeless, rough sleeping, or hidden homeless. We knew that hidden homelessness would play a pretty big role because people would lose the opportunities to sleep with family members or to share maybe overcrowded spaces. And then food insecurity was the other piece. And so people made vulnerable through food-related things and the policies and practices around getting access to food, but also to be able to keep people in their homes, if they had access to housing, how do we ensure that they didn't have to venture out to get access to adequate, affordable foods? And so, so this response really focused on housing insecurity and food insecurity and the policies and practices that needed to fall into place for the urgency of the COVID response. If you want to see some preliminary evaluation around these pieces from the interagency response, there's a link in the PowerPoint, which you'll get access to, but all these links will also be shared, like I said before. So what did it look like? In the very beginning, we realized as folks closed their doors that people in the core neighborhood, particularly in Saskatoon, needed in-person services. And so in partnership with what is now Prairie Harm Reduction, or previously AIDS Saskatoon, and the White Buffalo Youth Lodge and Saskatoon Tribal Council and other partners, an in-person service hub was built and opened at White Buffalo. There was another location too in a different part of the community that was open for a short period of time but didn't have as much traffic, and so we reconvened the energy into the core neighborhood hub. And once people were receiving services at the hub, it became very apparent that there were three core areas that they needed service supports in. One is access to income assistance. The other one was housing-related supports, and the third one was food. There was also, as time went by, an increasing need for mental health and substance use supports. And so from those conversations, additional service provision around providing temporary shelters, working with the current shelter system to ensure that COVID didn't take root in the shelter system, and making sure that folks in the core neighborhood who wouldn't normally have access through conventional methods of accessing health like 811 would have access to a core neighborhood testing site. And so the folks that are local within the health authority moved mountains to open a local testing site for folks who could come in without appointments to get access to testing. It became very obvious to us that the folks who are accessing testing who didn't have immediate access to being able to isolate was the next sort of phase of the work. This is probably the 100th time that I've had this conversation with folks. It's interesting when I talk about it, it sounds linear, but all of these things were happening at the same time in a fairly large, chaotic response to try and make sure that all the pieces could come together at the same time. And so once folks were tested, they needed to be isolated. If they couldn't isolate in their own space, it was inadequate, overcrowded, or they just didn't have any space to do that in, they were moved to temporary hotel shelter. Again, we tried to eliminate the ability for the homeless or emergency shelters to take on folks who are waiting for test results because we didn't want to introduce potentially positive folks into that system. Once folks were at the shelter, the hotel shelter, we knew that in order to keep them there, we would have to meet them with what they needed when they needed it. And so a harm reduction team was implemented, and we provided supports and services for people for what they needed, including pop-up managed alcohol programs and tobacco and other supports. And then there was another big piece around access to good food. And so there were a lot of conversations around access to food, around hampering or meals. Many of the meal providing services in the first part of the COVID response were closed, and so people did need access to meals. And so between all of the food teams, Saskatoon Food Bank and Learning Center, Friendship Inn, CHEP. And then it's a lot of folks sort of popping up to provide access to food, but also White Buffalo Youth Lodge and Saskatoon Tribal Council came together to build what I would say is a pretty elaborate response to food. I think it was fairly intense, and tens of thousands of meals were delivered. This is just an FYI. I'm not going to walk through it, but when I said we built an incident command structure, this is the last incident command structure model that was implemented just before we sort of wrapped into a interagency maintenance committee, which happened sort of the end of June. Like I said, we started with about 5 partners, and by the time we were up and running, we had a 35-partner organization, heavily supported by community agencies, the City of Saskatoon, the Housing Authority, SHIP, Prairie Harm Reduction, a bunch of sort of local community agencies, seconding staff working together towards a common agenda that was to prevent COVID from taking hold in the sector of the population that lives in our core neighborhood predominantly. If you are interested and want more details specifically about how the interagency response worked or how this incident command structure worked, that could be another entirely different conversation. So again, what did it actually look like in community? About 100-ish days, the interagency response to COVID was up and fully operational. And we looked specifically at things that, again, were around housing insecurity and food insecurity. And so stepping back, even though we were in the depths of an incident command structure, which is really quite a hierarchical and quite colonial model, there were some lessons learned around collective impact and the work that we can be doing together moving forward. I think one of the biggest pieces for me from the interagency response process is that all of the collaborative work that happened in Saskatoon leading up to COVID started the pathway to be able to do this work in the way that we did it. The day that we decided that we were in this mode, it was a conscious decision for all the agencies involved to work throughout that one common agenda, seconding of staff, pooling of resources, building of portals to move money through, building a logistics team that would be able to provide PPE, et cetera. And many of those pieces are still operational today. And so what we did know is that without barrier, access to testing was a critical piece if we were going to improve the health and well-being of the folks in the downtown core. And so we also knew that those services are often responsible for the release to homelessness. And so we were not going to take folks into a testing site, place them temporarily into shelter like a hotel for up to 14 days, and then release them into nothing. And so the housing team and much of the funding that came from the emergency response from the federal government through Reaching Home and other portals, the ESCF, et cetera, were used to build a permanent housing solution process for folks who were facing housing precarity during COVID. And since COVID, we've housed, excluding the conversation around the closure of the Northwoods, upwards of about 80 folks who haven't previously been permanently housed are now in relatively decent housing solutions. Not to say that there isn't more work to be done, because there certainly is. That meal and food delivery system saw tens of thousands of meals and hampers delivered to residents in need over across the city. There was much discussion around the delivery of meals and also the role that a delivery of meal played in just the mental health and well-being for families who were thrown into chaos, particularly when schools closed and businesses closed and people lost jobs. And so we're in the process now of looking at, what did we learn around the food access piece and how do we talk specifically about the request in the 12 Bold Ideas for food in all neighborhoods. We saw the cities across Canada, but Saskatoon and Regina make transit free and how important it was that folks had access to free transit. They also made parking free, which was also a different piece, but not necessarily tied to the sector that we were working within, but also an important part for folks, particularly in essential services, to get to and from the places they were going. We saw the input of income supports. This is a highly controversial and Erin said in the very beginning, we will be talking about many of these pieces more deeply over the course of this series of webinars. And so we're going to talk and unpack what's going on with income. So we saw the federal government step in with the CERB benefit. We've seen many implications to CERB over the last little bit. We saw supports for a moratorium on evictions and the implications associated with those. And we also saw relationships with the provincial income assistance programs be impacted by both the federal universal basic income, which is CERB, and other pieces of income supports across the province. We saw system navigation again at the forefront. I don't think in the whole 10 years I've been working with the Poverty Reduction Partnership that system navigation hasn't been in the forefront. We all know that the system that we have is not easily navigated. And we saw the importance of the creation of that essential services hub and that face-to-face support was a critical piece to people because they could get access to services when they were ready to get access to services. And so they could walk in and get support and services right there in the same day. And that we had a lot of conversations with service providers and police and first responders around accessing the right services and when and how harm reduction could be embedded in those responses. We saw a lot of supports and for students and families, and we also spent a fair amount of time doing some advocacy work. I think that's one of the pieces around incident command structures from an emergency management perspective that isn't embedded in those structures because fire departments generally don't have to advocate to the provincial government for the support to put out the fires. Yet the services and supports that communities, human service systems, and particularly those who support the clients that we're particularly talking about often have to spend a fair amount of time advocating for their work. And so we built an entire advocacy structure into the interagency response. And that team looked very specifically at the role the Housing Authority could play in alleviating or eliminating homelessness in Saskatoon and across the province for that matter, but also what the school divisions could do around leaving their technology with families over the summer, both the devices and the data. And also we talked specifically with the City of Saskatoon multiple times to advocate around tech and other things like access to public washrooms. And so I wanted to go back and say, out of the 12 bold ideas, what did we actually learn, and where should those pieces of learning take us into the next steps, and how do we talk specifically about building now an implementation strategy to call for the urgency to implement an elimination of poverty strategy in Saskatoon, or in this province for that matter. And so we're particularly interested in the impact of CERB and revisiting the conversation of guaranteed monthly income or universal basic income or the variety of different terms. But in this province specifically, the impact that has, because our province is notorious for using federal benefits as a mechanism to not live up to their fiduciary obligations within this province. And so we need to be very certain that when we call for certain policy and practice changes, that the ripple out impacts are well understood. We know that assets played a particular role in this pandemic and why it's critical to have assets in a time of uncertainty, and why policy and practice, particularly for folks who are living below the market basket measure, create situations where assets are not allowed to be accumulated. And in fact, the lower you get in that spectrum, assets are often criminalized. And that process needs to stop because now people fully understand the role that their assets have played during this pandemic. We've seen innovation in pivoting around economic recovery. And so what role does social enterprise and that innovation play in economic recovery in Saskatoon and in the province in general, and Canada for that matter? We've had a very long conversation in this province around the shortage of childcare, and why we need to be investing in early years, and why there needs to be an investment strategy for early years in Saskatoon and in the province, and what the provincial government's responsibility is for that. That was exacerbated during COVID. And because education is so tightly tied to childcare, we learned very quickly the role that the education system plays in stabilizing and supporting families, particularly families in need, through food access, through mental health supports, just through the general sort of mental health and well-being of children, but also the curricular pieces, the learning and what children and students will need moving forward. I talked about food security a lot, but we really need to start talking about how people can get access to food in their own neighborhoods. What's the sustainable model for that, and how do we distribute or make that access happen? I'm really quite interested to learn what public transit learned about their free transit system. And so we firmly believe that access to free transit, free to use transit, it doesn't mean that transit is free, we know that. It also doesn't mean that the city of Saskatoon is required to pay for that transit system using tax dollars. There are other methods of innovation, social enterprise, et cetera, that we can build into the transit system if we can just use what we've learned during COVID to pivot and think critically about the current system and what it could be modified to produce. Justice. This team, I'm working right now with the Anti-Racism Network as well to talk specifically about the criminalization of poverty. Both the COVID response and the Black Lives Matter movement illuminated this issue. The root causes of systemic injustice, racism, and inequity create poverty in this city and in Canada. And it's important to start talking very specifically about the criminalization of poverty and how it perpetuates the overrepresentation of particularly women of color through the apprehension of children and inequity associated with things that they're trying to do to make ends meet. And then housing was also a critical piece during the interagency response, and we learned very quickly as well that folks need, that Saskatoon and probably Saskatchewan in general does not have a really great transitional housing model. And so to be fair to the housing authority, they did provide access to units, but many of the folks that we were trying to move from isolation hotel into those units weren't ready to be living independently in a housing authority unit. And so it illuminated the need to talk very specifically about what intensive case management looks like. How do we do a 24/7, 365 outreach and intensive case management process in Saskatoon? And how do we start untangling the need for police to be the after hours only response mechanism? And so we're working right now to try and figure out how we embed those pieces and who is ultimately responsible for, one, providing it, and two, funding it. I've been talking a lot about how the urgency of COVID, and it's not to downplay the importance of COVID or what COVID has brought to many people and the deaths and loss of things over time from COVID. But quite frankly, poverty is a public health crisis in Saskatoon. Overdose is a public health crisis in Saskatoon. Mental health is a public health crisis. The mental health and suicides are a public health crisis in Saskatoon. And so we need to start thinking about what we learned from this urgency response and what can we then pivot and start talking about these larger systemic issues as a public health crisis. And so how do we embed the things that we learned from COVID to make policy and practice reflect the fact that we also need to take these things quite seriously and make fundamental changes to systems. Literacy also played a role in the interagency response. We spent a fair amount of time supporting families and elders, particularly with access to technology, but also other services and supports around decreasing isolation, et cetera, so that folks could get access to supports and services online, things like financial literacy for CERB and understanding what a moratorium on rent was. Many of the community partners worked on those pieces to ensure that people were not making decisions without the right information, and that the ramifications of not providing these access points or pieces of information could potentially throw a lot of even new folks into a cycle of poverty once reopen started to happen. System navigation for the interagency response was a critical piece, and because many of the places that provided face-to-face options for people were closing, we had a very interesting conversation around the technology divide. And so we spent a fair amount of time trying to figure out how to get people access to services and supports when there were no abilities to do that in face-to-face. And so near the end of the response, the City of Saskatoon allocated some of its MEEP funding. I don't know what MEEP stands for, MEEP. It's like a municipal infrastructure grant to a pilot project to blanket Wi-Fi, one of the neighborhoods in the core neighborhood, to see what would happen to access to services, etc. If people could have devices and access to Wi-Fi. And so we'll be looking at that process moving forward to see what we would learn and try to figure out what are the best options now that reopen is happening, but also we know that there will be limitations to reopen and the ability to provide as many services and supports moving forward that we did pre-COVID probably won't happen for quite some time. And so I think the interesting piece from SPRP's perspective is that all of the things that we flagged pre-COVID found their way into the response to COVID. And now that we emerge out of COVID, how do we use the things that we learned to pivot the work, to draw attention to pieces that we believe should be fundamental parts of public policy? And how do we then work towards eliminating poverty in Saskatoon? There were some critical gaps that came up, and so I'll just sort of end with this piece. I did mention earlier, transitional housing in Saskatoon is basically non-existent. We knew this pre-COVID, and we have a big systems map around housing, and so we know what needs to happen, and so we'll be working with many of the partners who are now involved in this process to try and figure out what the best course of action is to take folks from unsheltered or released from a system that is creating unshelteredness into some kind of transitional housing option with wraparound services, which is tightly tied to the harm reduction conversation. And so we learned, many of us learned the importance of intensive case management from across agencies and jurisdictions, and that harm reduction and trauma-informed practice is a critical piece to ensuring the success, but also to ensure that further harm isn't created when supporting clients. I'm going to talk about the digital divide because I already did. We also realized very quickly, we knew previous to COVID that public library and other agencies that have access to free technology played a critical role. When those doors closed, it became highly problematic for people. It became problematic from a healthcare perspective, but also from just a connection, education perspective. And so all of those pieces will be talked about deeper. I think there's a technology and digital divide conversation coming up later on in the series of webinars. And then the last big piece that we learned was access to public washrooms. And so Saskatoon really does require a 24/7, 365 public washroom structure, particularly in the core neighborhood, not tucked away in a pathway somewhere close to the river. During Colson community went without 100+ days without no access to a public washroom. Highly problematic for a variety of different reasons. And so we're working to make public washroom an issue moving forward, particularly during the election cycle, but also post-election to see what the city of Saskatoon can do about creating an accessible 24/7, 365 public washroom structure. So generally speaking, all of these ideas were embedded in some capacity, either by the interagency response itself, by people who are working within the agency, and by government. Mostly the government response for us would be federally motivated. Our provincial government didn't play a very large role either in funding or creating policy and practice that made this work easier. But moving forwards, we now have this idea around how we can make this work urgent. And so now it's the time to take those pieces, move it forward, and make poverty an urgent public health crisis, and implement the ideas and pivot the ideas based on the learning moving forward. And here is all the contact information. And that is the end.
Thanks for that. And if we can just have another 10 minutes or so left, maybe we should just move directly into some questions and comments. We had a few people share in advance some questions. And I know there's been a few things been added to the chat. So for those attending right now, please do add. But maybe we can start. Colleen, do you have a list here, or I can read it off as well. One thing that was brought up was the idea of language. The idea of, how to replace, just going to read a question that was submitted. How do we place the humanity of people we're talking about, sadly more often than with, at the forefront? So using language such as the homeless people versus the homeless.
Yeah, and we have a lot of conversations about the power of language. The 12 Bold Ideas language, most of it, or all of it, was informed and directed by a team of folks who would identify as having living or lived experience of poverty. And so we talk a lot about policy and practices that create poverty or that people are living in poverty. And the flip side is that we don't want to put the blame on the folks. And so we need to sort of morph our language that puts the center of attention back on the policy or the practice. And so displacement or release from systems into poverty or into homelessness is actually the responsibility of the system and not the responsibility of the person that's being released. And so we're working with, we have a community of practice for people with lived and living experience that is emerging. It's always been in existence, but there seems to be more and more folks coming and wanting to get involved. And I think Colleen Hamilton posted in the chat, she's one of our colleagues that has tremendous insights and supports and guidance for us around how we should be talking about people and the policies and practices that are directly impacting those people. So yeah, it's an important piece of the work.
Actually, connected to that, someone mentioned the idea of tossing out the term vulnerable.
Yeah, we've had that conversation a lot. Yeah. Yeah, so one of the reasons why we inherited the word invulnerable right off the get-go for the interagency response anyway is tied to the incident command structure, and we pushed back and forth in those conversations, the vulnerable sector strategy. But you're right, it's people made vulnerable by systems and people made vulnerable by inequity, et cetera. And so, and also how do you know, like, what kind of vulnerability? And so we were very clear in saying that we're talking about housing and housing insecurity and the ties to food and food insecurity. Underlying that, there's always a conversation about income. But because we didn't have a lot of jurisdiction around income in this response, it was always just sort of part of the process. But yeah, it's vulnerable. That word irritates a lot of us.
I know there's a lot of interesting writing that's been done on that as well in the academic literature. There's another interesting question from, I'm not sure if this is from a student, although I would assume it is. How have students been affected and why are they not considered to be part of the poverty line?
Oh, so I'm not going to talk specifically about the poverty line. I'm going to let Chuck, when he talks about market basket measure, talk about students and the implications. Sorry, Chuck, I know you're on the line. You're like, don't throw it back to me. Or he can unmute. I don't even think he's allowed to unmute himself. I think that's probably illegal because you're not actually a panelist. You can wait and talk to Chuck about the market basket measure and all of the implications around how they design that measure. But during the interagency response and in the Saskatoon Poverty Reduction Partnership itself, there is a youth team that we talk to. And so we are quite interested in the relationship for particularly youth that are emerging out of the K-12 environment or out of foster care. So that sort of 14 to 18 range is involved. And so the interagency response did have a youth team. They did work. We hired some youth who are connected to community and have a pretty solid relationship with many of the youth who may find themselves in circumstances where they are housing or food insecure, and to ensure that that voice was not left out of the response. Mm-hmm. It is a critical piece. And often, I think, particularly if you talk about university students, they're often not highlighted either, particularly international students.
You know, there's been lots of conversations on campus. Maybe another conversation topic moving forward.
Yeah, that would be a good one.
There's certainly a number of disability advocates on the call today, and we had a couple questions. One specifically around how does poverty affect different populations like those with disabilities and Indigenous people with disabilities? Any thoughts on that?
Yeah, so I mean, clearly, every time you have a complicated social determinative of health issue, you're further marginalized or alienated or more vulnerable, whatever. And so folks with disabilities, during the interagency response specifically, we did talk and had some folks who were tied to the disability work in Saskatoon informing some of that decision making. Moving forward, and pre-COVID, during transit conversations, we had multiple conversations around the ineffectiveness of transit to support folks who have disability needs, and not just access transit, but transit in general. I mean, if we want to talk about access to transit, that's a whole other conversation, but we talk very specifically about how transit doesn't meet the needs of folks who may not need to use access transit. And then how do things like building the built environment and the ability to access place impact folks who have maybe mobility or other related challenges. And so we do work with some folks around disability, but it's not, it doesn't have like an action team, and it probably could very well have an action team that works specifically on, you know, what about the 12 bold ideas are further exacerbated when you have disability-related needs.
Yeah, I think that's really important to me. Another topic area for sure. And a comment from one of our participants around, I appreciate you mentioning that the public washrooms should be accessible. I see how disability intersects with every one of these bold ideas.
Yeah, public washrooms was a really interesting conversation. I think many of us with privilege didn't even really contemplate it, right? Until probably it's hard to put times on what happened during COVID, but I think probably about maybe 4 or 5 weeks into the response, it started to become highly problematic. And so the interagency response started its campaign to the city to open their public washrooms. And that conversation was eye-opening for many of us around, you know, what people think public washrooms are used for and the judgment and systemic racism that's riddled through those conversations and how we had to unpack them. Access to public washrooms is not just about people who are homeless. It's about anyone who is out and about who needs to use the washroom. Going to the washroom is not a thing that only homeless people do, right? And so and we also don't have a schedule for when we need to go to the washroom. And so the idea that the public washroom is open from 8 to 4 is also a little bit ridiculous. And so we did a fairly lengthy investigation. We had some Making the Link students who are working on projects with us that came from the College of Medicine, and one of the students there did a very great report around what public washrooms could look like and gave us some best practice. We talked to Edmonton at length around what that could look like. But yeah, there's folks in the chat talking about who else uses the public washroom. Like even taxi drivers and people with business and those kind of things needed public washrooms. Seniors who just wanted to go for a walk in the park because they needed to get out of their space and it was a safe thing to do, got partway through the walk and realized that they couldn't go to the washroom anywhere. People with health-related complications who need access to a public washroom on a fairly routine basis were also not then able to leave their house. And so this is a much larger issue than just talking about homelessness and folks who may be in the core neighborhood and needing those washrooms. And that many of the washrooms that are currently open may not be accessible, wheelchair accessible. Even in the location that could be wheelchair accessible or safe for women. So we need to have a really serious conversation around what access to public washrooms looks like And as we move forward around mandatory mask usage, how people could get access to running water and soap to wash their hands, but also to wash masks, etc. like that. So there's like a fundamental piece around potable water, soap, water, and toilets that needs to happen in Saskatoon, and probably maybe in Regina too. I think there's some folks from Regina. I don't think Regina has a 24/7, 365 public washroom either. And so we need to have a conversation in this province around why it's a critical piece.
And certainly, who else is still with us, but for those who are involved in global health work, which there were a number of people here, you will know the importance of this just in global context as well. So I see the time is 1:29, and I definitely don't want to keep you over. We promised it would be an hour. So there were a few other comments and questions, but we'll take them and integrate them into some of the future and ongoing conversations. So please do join us for just want to thank Colleen so much for sharing the work and insights of SPRP and some of the lessons learned through the COVID response and the current call to reignite urgent action towards poverty elimination in Saskatoon and in Saskatchewan. So these are obviously very timely conversations, and we really look forward to taking a deeper dive into many of the issues and learnings that were brought up today and discussions for how to move forward. So again, if you have any specific topic areas or if you have expertise that you would like to share, we really do encourage you to get in contact with us, and I've just included our email in the chat. And again, as I mentioned earlier, please just follow us, our website, our social media, where we'll be posting upcoming conversations, and you can find the recording of this particular conversation as well on our website. So with that, I'll say goodbye, and thanks so much for joining us today. Enjoy the rest of your Friday, and take care of yourself. Bye, everybody.